So in the last lecture, we are at card repertories. We completed the card repertories and we are at clinical repertories. So as we know, the computer repertories. The computer repertories are the repertories which are helpful for which are very much used nowadays by the physician, and these repertories are helpful because they save a lot of time as well as to search through materia medica of symptoms. If we want to search the symptom through materia medica, in these repertories there are many materia medicas are included in these repertories. Then we can easily carry the whatever data of the patient, we can carry easily from one place to other place because all the data is we save all the data of the patient in our in very short space in the computer. Then for ready references it is very much helpful. Then for teaching purpose, therapeutic purpose, it is helpful. So in this way, the computer repertories, they are helpful to us in many ways. It creates impression on the patient. The number of options available for reference is immense and the work is very fast, may also carried to the bedside in the form of laptop. So we discussed also in the last lecture about the computer repertories. Then concordance repertories. The concordance repertories or Puritan repertories. The symptoms can be found out easily and saves a lot of time. It is a great manual to refer to any needed symptom, but not useful for systemic repertorization. As we discussed earlier that for systemic repertorization, these concordance repertories, Puritan repertories, they are not useful or used, but only for the reference purpose these repertories are used. Then errors in converting the patient symptom into rubric. Yes. Yes, is there any query? Yes. Errors in converting the patient symptom into the rubrics can be avoided because the symptoms are written as it is in the language of the patient. So we cannot convert the patient's language into the repertorial language that is in the form of rubric. So to find out the symptoms in the form of rubric, there may came error, there may came many difficulties to finding out the rubrics, so it can be avoided. Then the reliability of the symptoms and remedies is doubly ensured by repeated verification, observations and confirmations. By as the drug is proved on many persons at the same time at different places, so the symptoms and the indicated remedies, they are reliable because they are repeatedly verified, they are repeatedly observed in clinics and they are confirmed. So the reliability of symptoms and remedies are very good. Then it serves as a guide for further works on repertory. So to do the further work on the repertory, it is helpful. It acts as a guide in the for further work on the repertory. Then clinical repertories. As we know, the clinical repertory itself, in these repertory, the clinical rubrics are given. and especially in advanced pathological condition or any clinical condition, any pathological condition, whenever we cannot find out the proper simillimum, when we cannot get the proper symptoms from the patient, then to find out the indicated group of remedies, these repertories are helpful. And we also discussed about the different classification, different subgroups, subgroups of clinical repertories previously. So, what is the use of these clinical repertories? They are used as a quick reference book at the bedside. So, when we find out the simillimum, then when we refer these clinical repertories and we confirm that the whatever the medicine, whatever the simillimum we selected, is it indicated or is it given in these clinical repertories also. So for the quick reference, it is used at the bedside. Then help us to find it help us to find the most appropriate palliative medicine in incurable cases. When we give the palliative medicine, when the case is incurable, when the pathology of the patient is too much advanced, and in such case, when we lost the hopes of cure, in such cases, to palliate the symptoms, to give temporary relief to the patient, we select or we prescribe the palliative medicine. And to find out such most appropriate palliative medicine in incurable cases, these clinical repertories, they are very much helpful. Then it helps in finding out the simillimum in a specific clinical condition. So in specific clinical condition, we can able to find out the simillimum with help of these repertories. Then it helps to repertorize the following type of cases. In which cases these repertories are helpful to repertorize. So the cases lacking in mental and physical general but rich in common symptom. The common symptoms of clinical condition or disease condition, when we get such common symptoms related to disease condition, then and in that case we cannot found the mental and physical general symptoms, then these repertories are helpful to find out the simillimum. Then cases with clinical diagnosis. In the same way as in the first point we discussed that we cannot get the other symptoms, we cannot get any mental general, any specific mental general, any specific physical general or any characteristic particular. We get only clinical diagnostic features, symptoms, and all the clinical symptoms, they are common symptoms. We also cannot get the uncommon symptoms. So in cases with clinical diagnosis also, these repertories are very much helpful. Then the short cases with a very few symptoms. When we take the case of the patient and we get only few symptoms of the from the patient, when we take the history, then in such cases also, according to his clinical condition, according to his disease diagnosis, we can prescribe the medicine. Then thematic report.
मॅम
Yes,
मॅम
yes.
मॅम प्रीती घरगुडे आहे ना, तिला जॉईन केल्यापासून असं येतंय की रिजॉईन होत नाही आणि ते रिमूव्ह बाय होस्ट असं यायला लागलंय नोटीस.
Ask her to admit with her, rename herself and admit with her proper name. If she is there in waiting room,
येस मॅम.
why not she admitted with her name? Okay, I admit her. Okay, then thematic repertory. The addition of materia medica quotation makes it easy to differentiate the drugs from the main rubric. So, how with the help of materia medica we can differentiate the drugs. We can uh, differentiate one medicine from the other medicine. Then it helps to improve and innovate the existing mind section of the repertories. So it helps to improve and innovate the existing mind section of the repertory. In these repertories, the mind section is get improved. There is a great difference in vocabulary between the repertory and materia medica. In compiling the work, the author attempted to satisfy these points. Yes, yes, Pratnya. Any problem, Pratnya?
No, ma'am.
Then why you raise hand? Okay, there is a great difference in vocabulary between the repertory and materia medica. In compiling the work, the author attempted to satisfy these points by referencing the symptoms in the repertory back to the original source in the proving. So, as in the repertory, we write down the symptoms in the language of the repertory. So in materia medica, the symptoms are written in different way, and in repertory, the symptoms are written in different way in the form of rubric in repertory language. So there is a great difference in vocabulary between the repertory and materia medica. So to overcome this problem, while compiling these type of repertories, the thematic repertories, the author they attempted these points by referring the symptoms in the repertory back to the original source in the proving. So from where they have taken these symptom, they give the reference of that symptom at the back of the repertory or at the end of the repertory, so that to avoid the confusion between the symptoms. Then clinical application of different repertories in different type of cases. So this is not came under the proper classification of repertory, but the clinical application of different repertories, it is helpful for the clinical point of view, as well as you should know which repertories are useful for which type of cases. We will discuss it one by one. So, general choice of repertory. Which repertory we can choose for which type of case? So, general type of repertory, that is choice of repertory, symptoms present. If while taking the case, which repertory we should choose? As we have discussed the classification of repertory, if we get the general symptoms more prominently, then in that we get the mental generals prominently, then we choose the repertories based on the philosophy behind the general to particular, or the philosophy based on the deductive logic. For example, Kant's repertory, complete repertory. Then if in that case, when we take the case history of the patient and we get the prominent physical general symptoms, or we get the physical particular symptoms, then we focus on the repertories which are based on the particular symptoms or the complete symptom. Then we choose the repertories of Boning Hussein's, that is Boning Hussein therapeutic pocketbook, Boger Boning Hussein's characteristic repertory, and if the Boning Hussein's characteristic Boning Hussein's therapeutic pocketbook and Boning Hussein's synoptic key, then when the symptoms are pathological generals in the case, then we choose the BBCR, that is Boger Boning Hussein's characteristic repertory, because in this repertory BBCR there are many pathological rubrics we found. Most of the pathological rubrics he tried to include in his repertory, that is Boger Boning Hussein characteristic repertory. Then if we found the only particular symptoms most prominently in the case, then we select the regional repertories, or the repertories, regional repertories means in short the clinical repertories, because the symptoms are particular symptoms, they are clinical symptoms, and they cover the region, part of the body, system of the person, or the whole person with the clinical symptoms. So accordingly, according to the classification, sub-classification, we can choose the repertory. Sorry. For easy understanding about the selection of repertories, Hahnemannian classification of diseases is necessary. Which is the Hahnemannian classification of diseases that we discussed first? That was the Hahnemannian classification of diseases. That is, he classified the diseases. We discussed it later on. How Dr. Hahnemann he classified the diseases, acute diseases, chronic diseases. It was we discussed later on in case taking the classification of diseases. In short, today we discuss about it. Hahnemannian classification of diseases. So Hahnemann classified the diseases into indisposition, dynamic, and surgical diseases. Then in dynamic diseases, it may be acute, it may be chronic. Then if it was acute, then it may be sporadic, it may be endemic, it may be epidemic. About all these types, that is indisposition, dynamic, surgical, what is sporadic, endemic, epidemic, what is non-miasmatic, miasmatic, we will discuss in detail in case taking. Okay, now only we in short we discuss about this classification. So if it was the chronic disease, then diseases with fully developed symptoms and diseases with symptom. Yes. Then if the diseases are with fully developed symptoms, then it may be non-miasmatic, miasmatic, intermittent diseases. And if it is few symptoms, then it may be one-sided or local diseases. Then what is indisposition? So it was given in aphorism number 150. You had learned it, what is indisposition. You know about indisposition, you might have completed in your second year syllabus. Yes. Indisposition, anyone? And dynamic diseases. So in case of dynamic diseases, it is classified into two groups, that is acute diseases and chronic diseases. So in acute diseases, the repertories used, or we select the repertories which are suited for acute disease condition, that is repertory of antisoric medicine by Boning-Hussein, Bogar synoptic, Boning-Hussein's characteristic and repertory, Fatak repertory. All clinical repertories and general repertories also can be used especially in acute disease conditions. Then in epidemic diseases, the if epidemic disease is of gastroenteritis, then we choose the repertory related to, or the repertory in which the symptoms are indicated for the GI infection, or all the GI symptoms they are included in the repertory. That repertory we choose for the epidemic of gastroenteritis. So the example is Bell's diarrhea. Then epidemics of fever, if there is epidemic of fever, then we choose the repertory of intermittent fever by W.A. Allen, then therapeutics of fever by H.C. Allen, repertory of typhoid fever by Panelli, repertory of scarlet fever by Rushmore. So in this way we choose the repertories in which that disease condition was given. Then in chronic diseases, we use the repertories. All general repertories can be utilized for the fully developed dynamic chronic diseases. Because in chronic diseases, why we choose the general repertory? Because in chronic diseases, we should consider the person as a whole. We treat the individual. When we are going to cure the person, then we considered the person as a whole, not his part, not his body, or not his symptoms. So we should consider, for considering the person as a whole, we should consider or we should use the general repertories for the for curing the chronic cases. Then non-miasmatic chronic diseases, we should use repertories for the occupational diseases like NAIRS repertory, Clark's clinical repertory, Horrick's repertory, latest general repertories like synthesis, Murphy's repertory, complete repertory. So these repertories are very much helpful for the occupational diseases. For intermittent diseases, repertories related to febrile intermittent disease. BPCR, in it, the fever section, it is very much useful. Then the repertory for intermittent fever, which is written by W.A. Allen, therapeutics of fever by H.C. Allen, then repertory of intermittent fever by Dr. Boning-Hussein. Repertory related to febrile intermittent diseases. So the example of these repertories are repertory of headache by Nidby, then repertory of migraine and other headache concomitants by Siju PV. Then one-sided diseases. If the disease is one-sided, about one-sided, you have completed also one-sided diseases. Yes, in second year.
Yes, ma'am.
So in
Yes,
one-sided diseases,
ma'am.
it was given from aphorism number